If your dog's mouth is swollen right now, what you learn in this video could protect his life. This video will clearly explain what problem your dog is facing, why it happens, and what you should do. So stay till the end, because missing one sign could cost precious time. When a dog's mouth suddenly swells, it is the body screaming that something is wrong inside or outside. The swelling may appear on the lips, gums, tongue, cheeks, or even spread to the face and jaw. Sometimes it looks soft and puffy, sometimes firm and painful, and sometimes it comes with drooling, bad smell, bleeding, or refusal to eat. Many dogs become quiet, avoid touch, paw at their mouth, or suddenly stop eating even their favorite food. Some dogs show breathing discomfort, which makes this situation extremely serious. A sudden mouth swelling is never normal, even if your dog still looks active. One common cause is an allergic reaction. Dogs can react suddenly to insect bites, bee stings, ants, food changes, medicines, vaccines, or even something they licked or chewed outside. Allergic swelling often comes fast and can affect lips and face together. The danger here is that swelling can spread to the throat, making breathing difficult. Even if swelling looks mild at first, allergies can escalate within minutes or hours. Another major cause is dental infection or tooth abscess. When bacteria grow under a tooth or in the gums, pus builds up and causes visible swelling on one side of the mouth or face. These dogs often have bad breath, chew on one side, drop food, or cry when eating. Dental infections do not heal on their own. If ignored, the infection can spread to the jawbone or bloodstream. Mouth injuries and trauma are also common reasons. Dogs love chewing sticks, bones, stones, toys, or even metal objects. A sharp object can cut the gums, puncture the mouth lining, or get stuck between teeth. Swelling happens as the body reacts to injury. Sometimes the object is still lodged inside and not visible unless carefully checked. Foreign bodies like grass-ons, thorns, splinters, or plant seeds can hide inside the gums or under the tongue. These cause localized swelling, pain, and drooling. Dogs may constantly lick their lips or shake their head. This is often missed because the dog looks fine from the outside. Another serious cause is oral tumors or growths. Some tumors grow silently and suddenly become noticeable when swelling appears. These can be benign or malignant. Signs include uneven swelling, bleeding, foul odor, loose teeth, or a mass inside the mouth. Tumors need early diagnosis because delay reduces treatment options. Infections of the salivary glands or blocked salivary ducts can cause swelling under the jaw or near the mouth. These swellings often feel soft and may grow over time. Dogs may drool excessively or struggle to swallow. In rare but dangerous cases, poisoning or chemical exposure can cause mouth swelling. Cleaning products, pesticides, toxic plants, or harsh chemicals can burn mouth tissues. This usually comes with excessive drooling, pawing at the mouth, vomiting, or sudden panic behavior. If your dog's mouth is swollen, do not wait and watch for days. You should consult a veterinarian as soon as possible, especially if swelling is increasing, your dog refuses food, seems in pain, or has breathing trouble. Early treatment prevents complications and reduces suffering. Now let's talk about why these problems happen, because understanding the cause helps you prevent it in the future. Dogs explore the world with their mouths. They chew without knowing danger, sniff insects, lick unknown substances, and hide pain until it becomes severe. Dental disease builds slowly and shows suddenly. Allergies appear without warning. Infections grow silently. This is why mouth swelling often feels sudden even though the problem started earlier. Now that you understand the serious causes behind sudden mouth swelling, the next step is knowing exactly what to do and how each cause is treated, because wrong action or delay can make things worse. The first rule is simple but critical. Never try to pop, squeeze, or press a swollen area in your dog's mouth. Swelling may contain infection, damaged tissue, or sensitive blood vessels, and touching it forcefully can cause extreme pain or spread infection deeper. If the swelling is caused by an allergic reaction, treatment depends on how fast and severe it is. Mild swelling may reduce with proper medication, but fast-growing swelling, facial puffiness, or breathing changes need immediate medical attention. Veterinarians often use antihistamines, steroids, or emergency injections to stop the reaction. The most important part is identifying the trigger so it doesn't happen again. This could be a specific food, insect, plant, or medication your dog was exposed to shortly before the swelling started. For dental infections or tooth abscesses, treatment focuses on removing the source of infection. Antibiotics alone are not enough in most cases. The infected tooth often needs extraction or deep dental cleaning under anesthesia. Once the pressure and bacteria are removed, swelling usually reduces quickly. Dogs feel noticeable relief after proper dental treatment, which is why delaying dental care only increases pain and risk. When swelling comes from mouth injuries, vets first check for hidden wounds, broken teeth, or objects stuck inside. If a foreign object is found, it is carefully removed. Cuts or punctures may need cleaning, medication, and sometimes stitches. Pain control is very important here, because dogs with mouth pain may stop eating completely, leading to weakness and dehydration. In cases of foreign bodies like grass, awns, or thorns, removal is the only solution. These objects continue irritating the tissue until taken out. After removal, anti-inflammatory and antibiotic treatment helps the tissue heal and reduces swelling. The sooner these objects are removed, the faster recovery happens. If the swelling is due to oral tumors or abnormal growths, diagnosis comes first. Vets may recommend a biopsy or imaging to identify the type of growth. Treatment options depend on whether the tumor is benign or malignant. Early detection can mean simple surgical removal, while late detection may require more aggressive treatment. This is why ignoring unexplained swelling for weeks is extremely dangerous. For salivary gland infections or blockages, treatment may include antibiotics, anti-inflammatory medication, drainage, or surgery in chronic cases. These swellings may look harmless at first, but can grow large and uncomfortable if left untreated. If poisoning or chemical exposure is suspected, time becomes the biggest factor. Immediate veterinary care is necessary. The mouth tissues may be burned or damaged internally, and internal organs may also be affected. Treatment focuses on stabilizing the dog, protecting tissues, and preventing further absorption of toxins. At home, while arranging veterinary care, you can help by keeping your dog calm, preventing chewing on hard objects, and offering soft food only if your dog is willing to eat. Do not apply human creams, oils, or home remedies inside the mouth. Cold compresses on the outside of the face may reduce swelling slightly, but only if your dog tolerates it without stress. Prevention plays a big role moving forward. Regular dental checks, safe chew toys, controlled outdoor access, and watching what your dog puts in his mouth significantly reduce risks. Avoid sudden food changes, keep chemicals locked away, and observe your dog closely after vaccinations or new medications. By now, you can see that sudden mouth swelling is not a small issue. Each cause has a specific treatment, and guessing or waiting can allow simple problems to turn serious. Acting early protects your dog from pain, infection spread, and life-threatening complications. Once the swelling is treated and your dog starts to recover, the most important phase begins, and that is long-term care and prevention, because mouth swelling is often a warning sign that something deeper needs attention. Many dogs recover physically but return to the same habits that caused the problem in the first place, which is why some dogs experience repeated swelling months later. Long-term oral care is one of the strongest protections you can give your dog. Regular dental checkups help detect gum disease, cracked teeth, and infections before they turn into visible swelling. Even dogs that eat well and look healthy can hide dental pain for a long time. Brushing your dog's teeth with dog-safe toothpaste, offering dental chews approved by veterinarians, and avoiding extremely hard chew objects all reduce pressure on the gums and teeth. Diet also plays a major role in mouth health. Feeding consistent, high-quality food prevents sudden allergic reactions and supports gum strength. Rapid food changes can shock a dog's immune system and trigger facial or mouth swelling. If your dog has experienced allergic swelling before, keeping a simple food diary helps identify triggers and prevents repeat reactions. Your dog's environment matters more than most owners realize. Supervised outdoor time reduces exposure to insects, toxic plants, sharp sticks, and harmful objects. Many cases of mouth injury and foreign body swelling happen during unsupervised play. Choosing safe toys and regularly checking them for damage prevents broken pieces from cutting the mouth. Monitoring behavior changes is a powerful early warning system. Dogs rarely cry loudly when something is wrong, but they show signs in subtle ways. Slower eating, dropping food, chewing on one side, excessive drooling, lip licking, head shaking, or avoiding touch around the face are signals that should never be ignored. Acting early often prevents swelling from ever appearing. For dogs with a history of oral tumors or salivary gland issues, scheduled follow-ups become essential. Even after successful treatment, regular exams help catch regrowth early when options are simpler and outcomes are better. Early detection saves both life and cost. Pain management during recovery is also critical. Soft food, calm surroundings, and reduced chewing allow tissues to heal properly. Dogs that feel pain may refuse food and become weak, so recovery should always focus on comfort and nutrition. Never stop prescribed medication early, even if swelling looks reduced. Another important step is owner awareness. Knowing that sudden mouth swelling is never just normal changes how quickly you react. Many serious cases become dangerous only because of delay. Your calm but fast response is often the difference between a simple treatment and a complex emergency. By understanding the causes, treatments, and long-term care, you are no longer guessing when something goes wrong. You become proactive instead of reactive. A dog's mouth is directly connected to breathing, eating, and overall health, and protecting it protects your dog's life.